Okay, this will going to be a little bit longer presentation or video definitely, because this is a presentation on part of the retinoscopy, optics of retinoscopy, optical principle and optics behind the reflex characteristics of retinoscope. So let me make it clear, this presentation is not made by me, but I was a moderator made by my student named Dhanush Neopane. So I'm going to just going through this presentation and discussing some important point of retinoscopes. I think it's very important for at a point of view of optometry student. So let's dive deeper into the presentation. I think it will be a long video. Okay, so just going slowly and understanding things and optics behind it and how it going to play with regular clinical scenarios and all these things. Okay, so basically, uh, what is retinoscope? Is a small handed device that emits the visible white light towards the pupil, isn't it? That's it's the simple thing. That's where it's a niche retinoscope. So I'm basically fan of the high-end retinoscope. An accurate objective measurement of the refractive stiff eye can be made. So it's depend upon the accurate, depend upon the skills, isn't it? It's depend upon the skills of the optometrist. It's not an autorefractor, isn't it? It's a retinoscope. So basically we have to do its objective measurement of refraction, but yes, definitely it's far more skill oriented. So it will take maybe 3 years and 4 years of continuous practice to become a moderately better with the retinoscope, and it take a lot of time to become a very good. Okay, so techniques known as, it's also called retinoscope, but I don't know, it's maybe misnomer with retino plus retina and scopy means to see. I think it's basically misnomer, but we use that term, I don't know, from historical point of view, but basic the best term is skyscopic. It's sky means shadow, and so umbra is scopic, and scotoscopic, so and dioptroscopic. There are a lot of terms, okay, but I think skyscope is very good term, but definitely we use this retinoscopy. I think that's misnomer. Okay, so where it starts from Sir William Bowman observed the linear fundus reflex by using plane mirror of ophthalmoscope. First it starts here, and then again Fredlin coatings compared the classical various reflex by simple mirror ophthalmoscope and myopia hyperemia astigmatism. Then Menging reflex that produce the fundus of eye. Then again, and finally Copeland. So Copeland introduced this linear filament, the linear reflex. So that's why sometimes we call Copeland as a father of strict retinoscopy, definitely. So Jacob Copeland. So finally Copeland introduced the linear reflex, linear light streaks. Okay. So type of retinoscope basically is reflecting mirror retinoscope, which is plane mirror, and these are some old historical purposes. Now these are the modern self-illuminated retinoscope, and I didn't, I have never used a sport retinoscope. I don't know. I have never used this sport retinoscope. Definitely, strict retinoscope is very, very, very useful, and I think that's the modern retinoscope what we are using currently. So these are for the pictures, and some I have seen this picture retinoscope in my in my Viva in bachelor's in optometry. Okay, so this is a sport retinoscope sport, and this strict retinoscope, and this is a hind retinoscope, and I'm fan of the hind retinoscope. Okay, so we send light, and it's from in this lamp is shown, and from the mirror light going to the eye, and this is convex mirror effect. Let's not go, I will go another. So part of the retinoscope, so external retinoscope looks like the simple head and the handle, and we can even remove head from the handle, isn't it? That's a handle. We have batteries here, and that's the head, and this is looking part. So head is a major part, isn't it? So in head, the upper portion of retinoscope, which consists of people. People is a far important concept. This is the people from which we, as an optometrist, view the reflex. Look, the retinal reflex with the skioscopy. And sleeve. This is a sleeve, isn't it? The sleeve which rotates the projected light and increase or decrease the project width. We can increase and decrease width. but definitely width, and which definitely it when we change the position increase, it means the change in versions, and when we rotate these things, it means that we are just changing the orientation. And the socket for the source of illumination bulb, and it's terminated to the fixed headpiece and handle of retinoscope. That's socket inside of the bulb. Okay, so handle means basically lower, it's battery, and the fixed system headpiece and socket of the system. It's you use battery and lock it for the powerhouse or whatever we can tell. So internal part component of the strict retinoscope, various commercial design strict retinoscope basically have two main component. What is two main component? Light projection system and examiner observation system. Examiner means optometrist. So observation system and light projection system. See, light projection system, it's really important whenever we talk about light projection system. We are going to talk about versions, and we are going to talk about changing the versions, like plane mirror effect and concave mirror effect. So don't confuse. There are mirrors. No, there are no mirrors. Yes, there are mirrors, but there are not two mirrors like plane mirror and another is concave mirror. That's just an effect. Yes, there is plane mirror, but plane mirror effect and concave mirror effect. There's an effect, and the effect mainly depend upon the distance between bulb and the condensing lens. That's crucial. That's crucial. Okay, as an optical point of view, I'll tell you later when it comes. Okay, see, a small bulb is having filament is used because we want streak, not we don't want a spot. So we don't want a spot, we want a streak. That's why a linear filament is used. Filament produce linear streak light. That's what we need. The width projected beam is narrowed and widened by moving the bulb towards the or down the sleeve. Okay, that's coupling type. So we will discuss turning the sleeve on the instrument, rotate the ball, which turns relocate the projective skin. We can we can change the strict orientation, isn't it? We can change 90 degree here or 120, 150 degree, whatever, or horizontal. We can do whatever, and we can also change the versions of the light. And that when we are changing the versions of the light, basically we are shifting from plano mirror effect to concave mirror effect. And concave mirror means plus, which means light going from parallel, it moves converging. So that's what concave mirror effect, and I'll discuss. Wait. So what condensing lens does, okay? Convex lens placed between the light source and the reflecting mirror called condensing lens, isn't it? There is a bulb and there is a plane mirror. One condensing lens is placed between what? Bulb and plane mirror, okay? So this condensing light rays light condenses the light rays that converges the light rays, okay? As the condensing lens lies in the path of the light, hence it focuses the ray from the bulb into the mirror. Okay, this point just remember. Used to control the versions of the streak moving silk down or up in aligned time. Wait, okay, I'll come to this. And plane mirror, mostly used, caused the bending of the light ray, which from bulb to the projected inside the patient. So light goes like this, and what we do, we put plane mirror at 45-degree angle, then it strikes and at the same time goes to the patient's eye, isn't it? Here's the patient eye, isn't it? So it goes to the patient's eye, so it changes the direction, it from upwards to directly to the patient's eye. So a small hole is, see, the small hole is unsevered area of the mirror allows pass certain light, which gives the opportunity to examine the view. So we are viewing from this. This is the people, isn't it? This is the people, and there will be a small hole. So when we light projected toward the patient and the reflex comes from that patient, we can observe from this small hole in the mirror. Okay, so mirror, the bypass light rays in coaxis part of the reflex. The reflecting mirror is placed angle at a 45-degree axis, so to the handle that causes the perpendicular light, isn't it? Light comes from this below and it's 45-degree angle, and we know that whenever mirror is at certain angle, it will create the reflection at exactly double angle. So that's why light goes exactly 90 degree. So that's the basic concept. Okay, so what about focusing of sleeves? And here is the optics, main optics. Okay, sleeves is hollow cylinder and can mount it in the head or handle of the retinoscope. It most instruments sleeves changes the focus by moving the bulb up or down or keeping the lens fixed place in a Copeland type, whatever it is. You see, in Copeland type or it will Welch Allen type, it doesn't matter. Some commercially available retinoscope condensing lens is moving up and down, and the versions of the light is and the change the versions of the light. The basic concept. See, this is the basic concept. Let's take an example. Here is the bulb. Okay, light is emitting from the bulb, and let's take an example. This distance is for example 10 centimeter. So if I put this uh, condensing lens here, then what happens? The light going out from the lens, it must be parallel, isn't it? If I put the lens at plus 10 diopter, because just plus 10 diopter, because 10 diopter has focal length of 10 centimeter, isn't it? And focal length of 10 centimeter means the bulb is placed at the focal length. And then what happens? That's a definition, isn't it? If something coming from focal length, light coming, divergent light coming from focal length, then by definition, primary focal point means the light goes parallel, isn't it? Isn't it simple? If what happens if, suppose example, this is the bulb and it mm, light emits from here, and it ball we place the lens far away, what happened? If primary focal point is definitely light going to be focused, isn't it? That's what we have. If primary focal point is object is way ahead, then primary focal point, this is f, then what happened? Light converges. And that's what the principle of doing this is plane mirror effect. This is concave mirror effect, because concave mirror does convergence of the light. That's what concave mirror effect. It's just an effect we get term mirror effect, but it's all about focus and refocus, and it's all about simple optics of convex lens. So this simple thing, you have to understand this concept, otherwise you don't understand what happens if sleeves goes up and what happens when sleeves goes down. Okay, so whenever sleeve go up, whenever there is a lens here, it gives parallel effect, isn't it? It gives planar effect because he's the focal point. And whenever lens come here, now can you imagine, focal length of the lens is here, now what happens? Light converges, isn't it? So that's the idea. Okay, it's the same idea. Plane mirror effect means the distance between this blob and lens is at focal focal length, distance between the focal length of the lens, or slightly shorter than focal length. That's why it's almost plane or slightly divergent. But see, the distance between this and this, I think it's clear. It's far more than clear. Distance between this and the focal point is here. Now, what happens? Definitely, if object is away from the focal length, light gets definitely converging, isn't it? And that's converging light emitting from the retinoscope is called concave effect, and it's called plane effect. It's just an effect. Okay, don't think that there will be a concave mirror. No, that's not the case. When sleeve is down, the concave mirror effect. It's an effect. So basically, it's a game of where is F and where is object. In this case, object is the ball, isn't it? Okay. So it's a system, just where's the line type and whatever type. Just remember, it's not about which moving where. Ball is moving or lens is moving. It doesn't matter. What matters is the distance. See, in this case, whatever moves, whenever it is in focus or just shorter than focus, plane mirror effect. Whenever the distance large, it's concave mirror effect. It's the same thing. Doesn't matter. So Plane mirror effect and concave mirror effect. That's what's the difference. So effective source lies behind the plane mirror, and effective source lies in front of the plane mirror. Okay. So basic thing is rays emerging from the source is parallel or slightly diverging in plane mirror effect, but here light must be converging. That's why we call concave mirror effect. So sleep up and down. Just remember this thing. I don't even I forget these things because which type is which. So basically, plane mirror effect with motion or against motion, but okay, that's motion is always opposite to of plane mirror effect. So it's always opposite to of that plane mirror. If plane mirror effect shows with motion, concave mirror effect shows against motion at the same time in same lenses. Okay, source is the outside of the focus of the content. That's what I'm telling you. That's what source is in outside the focus of the condensing lens. Source is outside of the focus of the condensing lens. No, source is inside of the focus of condensing. That's wrong. And source is outside of the focus of the condensing lens. That's the case. Source means the object is exactly opposite. Okay, source is in this case inside of the focus or exactly its focus in case of plane mirror inside of the focus or exactly its focus in case of concave mirror. Source is outside of the focus of condensing lens. Okay, that's exactly opposite thing. Okay, so it's inside, it's outside. Okay, against movement. Okay, whatever. Just this is another thing. Just this is just simple thing. Okay, I'm not going to explain this. See what I'm talking. Whenever you need concave mirror effect, the source must be outside of the focus plane. Okay, whenever you need plane mirror or at the plane mirror you need exactly at source at focal point or slightly under, which gives you diverging light. Okay, so observation system and see observation system, illumination system we have talked. Observation system is allows us to see the retinal reflex, and how will you see the small gap in the mirror, isn't it? Here the light goes to eye and the reflex from the retina directly come to the observer, as we are an optometrist. Okay, so reflected light from the illuminated retina pass through the peephole, and that's very important when you are talking about peephole, and the later they back to the end of the head of the retinoscope. The manner in which returning to rays are affected tell us about the optics of the eye, because this returning light can tell us the optics of eye, which is very important, isn't it? So basically, what is the optical principle of the retinoscope? Retinoscope works on the Foucault's principle. See, Foucault's principle. What is the Foucault's principle or Foucault's knife edge principle? So, knife edge principle is peephole of the retinoscope. If the knife edge is at peepholes of the retinoscope placed on the principal axis, the system displays bundle of axial ray transversely. The position of the knife edge blocked at the different part of the illumination beam. The form observer's shadow pattern depends upon the several factors. What are the factors? The distance between the focus and the knife edge, and the transverse position of the knife edge, and the aberration of the optical system. See, I think you feel a little bit confusing here, but let me explain with a picture. Okay, see, in this case, you'll see a little bit of different thing. What is the knife edge and what is knife edge lies at the focus, and what is like knife edge lies in front of the focus, and what is knife edge lies behind the focus. See, focal plane by the line, isn't it? This is the focal plane, and light is sent collimated. This is light collimated, and this is just a simple focal plane. What happens if knife is placed behind the focus, which means towards the observer? This is the observer, isn't it? Towards the observer, towards us, towards optometrist. If knife is placed towards before towards the observer, see, This is the place where knife edge is placed. In case of knife edge, in case of in case of retinoscope, is exactly the peephole. Just remember what these things, okay? It's peephole. If peephole is placed bef- before focus, or what do you call before focus or after focus? I think behind the focus, isn't it? Behind the focus. Behind the focus. If focus is happening before the peephole, then we will see against movement, opposite movement. It's very important. Opposite movement. Whenever you place that knife edge, which means in retinoscope, it's peephole, placed in front of the focus, you will see with movement, the same direction movement. And whenever you put knife edge exactly as focus point, then there is no movement. That's the neutralization, that's the hyperopia, and that's the myopic reflex, the hyperopic reflex, and that's exactly what neutralization reflex. That's where we found neutralization. Okay, suddenly becomes bright and dark without any apparent motion. Focal point, at focal point we have to put knife edge. In retinoscope, knife edge means peephole of the retinoscope. Okay, that's the concept of basically refraction and optics basically. Okay. Okay, I think I have to stop here for this video because it's going to be very large, and I'll definitely start another video, part 2, from this slide. Okay, this done. I think just we have to cut it. It's 21 minutes and my throat is aching. Okay, this done. Choose.